Good evening. Development and seniors, welcome to the virtual consultation on the National Plan for People with Intellectual Disabilities and Their Families, 2022-2027. This is the draft plan that aims to set out some of the actions that we need to take over the next 5 years to increase the quality of life that people with intellectual disabilities experience. We know that for many adults with intellectual disabilities, their families provide much of the day-to-day support that they need. The plan is therefore aimed to support their families' needs as well. This consultation will run for 2 weeks until May 31st, 2022. Thank you.
Minister, you're on mute.
Thank you, Amar. Good evening, everyone, and good evening to Bermuda. I am very pleased to be here tonight to welcome you to the virtual consultation on the draft national plan for people with intellectual disabilities and their families. The plan aims to ensure people with intellectual disabilities have healthy and happy lives. It is to be a guiding document for services and supports in this sector and will help coordinate actions and initiatives across the many various stakeholders. The plan's development, commissioned by the Ministry of Social Development and Seniors and spearheaded by the Mid-Atlantic Wellness Institute, has included a wide range of stakeholders, including the Ministry of Education and Health, community-based services, and advocates for this sector. I would like to thank them again for their dedication to this process. We are also committed to ensuring any plan about persons with intellectual disabilities includes them in its development and implementation. There are easy to read and audio versions available, and we will be engaging directly with persons with intellectual on the draft and for its implementation. And I encourage everyone watching to ask questions and give feedback tonight or through the other avenues available. As ensuring our community and supports meet the needs and upholds the rights of persons with intellectual disabilities, it's all of our responsibility. With that, I will hand the presentation over to Marissa Rogers, Director of Intellectual Disability Program at MWI, Dr. Alec Bush, clinical psychologist who has been working in the Intellectual Disabilities Program at MWI for the past 7 years, and Jose Lopez, father of Max Lopez, a 23-year-old young man with intellectual disability. He is a parent who has been a decades-long Bermuda disability community advocate. And with that said, welcome everyone, and I look forward to any questions and the presentation this evening.
Thank you, Minister. Thank you very much for that excellent introduction. And I'd now like to sort of start by giving a little bit of the background to where we are and to what we're trying to achieve with this plan. It is a very exciting time. It is the first time that Bermuda will have had a plan like this. And it's an absolutely fantastic opportunity for everyone to get it right and to improve services. A lot of the work that has gone in the background to this has been about collaboration, and I think that's one of the really strong parts of this plan that hopefully you will see as we go through. So what I want to do is to give a little bit of the background to what we're trying to achieve with the plan. We're going to tell you a little bit about it, about some of the main objectives within the plan, and we're really looking for feedback about the principles and visions of what we're trying to achieve. We've got 5 areas that we are trying to concentrate our efforts on, and we're looking for feedback on those. And then most importantly, we want to look at how we can involve the community in making sure that these changes happen. Right at the end, we'll be telling you a little bit more about how to give feedback in a variety of ways. But on this particular platform, you will be able to enter chat, which we will be picking up, and we will be using that for discussion as we go along. It is a draft plan, and I think it's very important. I want to emphasize that so that people are aware that this is the opportunities to us to refine it and to develop it further. This is not the done deal at the moment. So I'll now just describe a little bit about some of the reasons why we're developing this. We've written the plan largely because we know from local information, local data, and internationally that people with intellectual disabilities generally have much poorer physical and mental health than the general population. This often includes behaviour that can be quite challenging at times. They use general hospital services, GPs, dental practitioners, much more than the general population. They suffer more injuries, accidents, trips, falls than the general population. They tend to rely much more on social and community services than the general population. Unfortunately, they die younger, and families very clearly need more support. So on the back of that, that's some of the motivation for us writing the plan to try and address some of those gaps. Minister Furbert, Minister of Social Development and Seniors, has asked us has pulled together this small group asking us to develop this draft plan. And on the next slide, we'll see some of the aims of where we're trying to go. We're trying to look at the people who have additional needs, in particular, because they have profound and multiple disabilities. We know that there are groups of people who find it particularly hard to access the sort of services that they need. Many of them can become challenging at times. And if, in addition to an intellectual disability, you suffer with autism as well, you're going to have many additional challenges as well. We are focusing largely on adults. We recognise that a number of people would like to see a plan for people across the age span. We felt that it is better that we focus at the moment on adults because that's where some of the largest gaps have been identified. But we also recognise that the transition into adulthood generally starts at about age of 14. And it's important that we have some very good, effective transition plans in place so that as young people transition into adulthood, they are transitioning into services that are person-centred are going to meet their needs. We want to overall achieve services and plans and lifestyles for people where they can enjoy their lives, that they can be treated with dignity, to live in the same sort of communities that we all live in and have friends, that they can have the support that they need when they need it, and end up living a healthy, safe, and fulfilling life. And I think the emphasis I will really want to put on that is about the fulfilling life. So moving on to the next slide. There have been a large number of reports that have been written in the past, many of which have been acted upon. Some of the reports have looked at transitioning of people from the old St Brendan's out into the community group homes. We've looked at the recommendations that have come from those reports, some of which have been acted upon, some of which haven't had the funding or haven't had the opportunity or haven't had the collaborative willpower to make happen. So we've drawn on some of those old plans where they've been relevant. And we've had a group of stakeholders who've been meeting for the best part of a year now. Clinicians and managers from MWI, from K. Margaret Carter, Windreach, Tomorrow's Voices, Aging and Disability Services, Dame Marjorie Bean, parents and community advocates. And we've been meeting regularly and we've been reviewing what we know from the past, what we know from the present, and where we see things needing to go into the future. So that's led us to developing 4 principles that the plan is based upon. The principles that we've looked at, first of all, about rights. We know that people with intellectual disabilities are very vulnerable, and that it's really important that their human rights are protected fully. So one of the principles of the plan is to make sure that people with intellectual disabilities really do have their rights protected. The second principle is about supporting independence. We want to ensure that our services are not overly paternalistic, not overly protective, that allow people to be as independent as possible. And that's about services providing opportunities for people to be independent, which leads on to the third principle, which is about choice. Independence is very often about being able to make choices. We believe firmly that the plan, if it is going to be effective, has got to be supporting people to have a say in what happens to them. And then finally, it's all about inclusion, supporting people to do things that are important to all of us, to do it in community settings, to do it in the same sort of ways that all of us would like to be included in society. So those are the 4 principles of the plan. The aim is that everything that is contained within the plan should be trying to support one or more of those principles. What we'd like to do now, as you just saw on the banner, is to have some feedback on what people think about those principles. Do you agree with them? Do you think that it would make sense for us to change any of them? Just generally, what are people's thoughts about the principles that you see? You can write in the chat, and one of the moderators will pick those up. Give you a chance to make some comments. One comment I see there is very supportive, that those seem to be the great core principles for the plan. Another question that's been asked is about how do we offer choice to people who have very significant cognitive impairments? It's a very good question, that. It's one that I love being asked, because choice is very much about little things are important in life. We can tell with our clients who've got the most profound intellectual disabilities with no verbal communication, but we can tell when they're happy, we can tell when they're smiling, we can tell when they're liking something. Choice can be about all sorts of very small things in people's lives. One of the most skilled staff I remember working with recently used to get people's clothes out in the evening and offer them to a client and say, would you like to wear this shirt or this blouse or this one? And the person would look at the ones that they wanted. Now, that might seem a fairly small choice, but actually for that person, knowing that they were wearing the clothes that they had chosen was actually a very big issue. So one comment there that the principal writtens are a good start and would like to see them in action. And I think that is very much how we want this plan to be judged, by how well those principles are seen in action. So I'm picking up generally that there's general agreement, general support for that set of principles. But we need to make sure also that they are seen to, the plan is seen to be delivering on them. Rights are very important to involve all. Sometimes change is hard and we need to have a say. That's one of the other bits that we're going to be talking about later, is how do we involve people with intellectual disabilities themselves and also family carers in influencing what happens within services. Comments about the pleased to see that the transition period from school to young adulthood is being considered. And I think we've certainly in the adult services have got experience of some of the difficulties that can be faced when the planning isn't in place as well as it needs to be for young people moving into what is a very difficult transition for them and families. So I think I will stop now, and I will now like to hand over to Jose, who's going to talk us through some of the 5 priority areas where we've identified that we need some action.
Great, thank you, Alec, and good evening, everyone. With those 4 principles guiding this process, the plan focuses on 5 priority areas: quality of support to individuals and families, education and workforce, policy, regulation and accountability, financing, and advocacy and communication. We need your engagement to be sure that these are the right areas to focus efforts on, and if the steps in the underlying action plans will help Bermuda reach these goals. So this is, as Alex had said earlier, this is very much a in-progress plan, and more input is definitely needed to validate everything. Next, we'll describe the content of the 5 priority areas. We'll look at each in turn, and then later ask for your feedback about these goals. The first of the 5 goals is quality support that everyone can easily access to meet their needs so they can have a good life. This goal is concerned with having better coordinated access to daytime support that promotes increased independence and improved quality of life. Helping families in need of support to more easily obtain that support. Individuals who have the most complex support needs receive appropriate care that is close to home and is well coordinated. Families and individuals experience a smooth transition as they increase in age, impactful when going from school age to adulthood, as an example, and we've already heard in today's discussion. There will be a range of accessible housing options to support people, including when families can no longer provide care, meaning the best place for that person may no longer be at their family home, which is a very difficult situation to be in. The second goal is around education and workforce. Families and care staff will have the skills and help they need to be able to support a person with intellectual disabilities. This goal aims to create a training course for support worker staff that will help them to do their jobs well. Create training courses to support family members. Create training courses to help people with intellectual disabilities to make more choices in their lives to the extent possible. There will be plans for a training course aimed at helping the public better understand intellectual disabilities, advocating that persons with intellectual disabilities be treated with respect and dignity. The third goal concerns policy regulation and accountability. There will be support from government services to protect people with intellectual disabilities. We will work with the minister to set up a stakeholder oversight group. This group will monitor how the plan is progressing. Input to this group from people who use these services will be very important, particularly, reminiscing on the challenges that have been had in the past and how we can improve the process. That really is what we're hoping for with this plan. We will work out how we can set up a national disability case register to better give data for planning services. This, I think, is going to be impactful across many of Bermuda's government entities and will allow us to get a hold of how many persons we actually have in Bermuda with disabilities that require disability services. Super important, not only for the health service side of things, but also the financial side and getting a grip of all these expensive services and how best to manage that. We'll make plans to strengthen or expand laws that protect vulnerable people. We'll work more closely with Bermuda Health Council to strengthen home care standards for people in group homes. We will find better ways to check for gaps in services and work out how to improve services overall. The fourth goal concerns financing. Government money is to be used carefully so that it goes to places where it can help as many people as possible. We will review how budgets for day programs are used. We will look at how well the community intellectual disability team can fill some of the gaps in specialist health services. Resources are allocated to clients and their families based on need to ensure that people with high support needs can access sufficient skilled support, enabling them to age in place, targeting services toward greatest need. People with intellectual disabilities and their families are able to benefit fully from health insurance schemes. We will review how health insurance can more effectively help people. Local specialist care is available, so we rely less on overseas placements. The fifth goal is advocacy and communication. People with intellectual disabilities and their caregivers will be involved in planning their care. This goal sets out to improve information about resources and involve those most impacted. The public are well informed about the rights and needs of persons with intellectual disabilities and are aware of the available resources they can access. Family carers are involved in the planning and delivery of services, and people with intellectual disabilities themselves are involved in the planning and delivery of those services. With that, I'll pass it on to Marissa to begin the feedback of each of these goals.
Thank you, Jose. Really appreciate your discussion on that. Essentially, we recognize that these goals are not exhaustive by any means. Those core goals are to really focus the work that we believe needs to be done over the next 5 years. So the list that you see under Goal 1 is what we would like to see happen over the next year, and where those actions then will need to be continued. So we would like to get your feedback at this time. I know Jose has reviewed each of the areas in Goal 1. So this is an opportunity for you to provide feedback about some of those goals. Do you believe they make sense? Are they heading in the direction that you would like to see? And is there any comments, feedbacks, or additions that you think need to be there? We will give you some time to go ahead and pop those into the chat, and we will certainly read them aloud. But I thought while we wait to do that, it would be great to talk about one of those objectives where it talks about transition. And I thought it might be a great time, Jose, you could probably speak from experience. What can we improve on with transition at this point from your perspective?
Yeah, I really do think that it's one of those areas that even though a family knows it's coming, it still is quite a challenge to go through. A lot of times it's a matter of, well, what services will be available? How do you really understand what's best for your person's situation? And then how much will the family have to take on versus how much of government services will be able to support the family circumstance. So I would say that is an area that, is going to require a lot of coordination. And for me, that's always been the bright spot. And one of the hopeful things about Bermuda is that all the persons that I've come across in education and health, the vast majority really are doing their absolute best to make everything work. The challenge is, are we well organized enough? Do we have good enough of a handle on what budget is needed? And how do we advocate for those things that are needed? That is probably the biggest challenge in smoothing out transitions. But better data, more accurate financing, and then improving the coordination between the different services will be a big part of this plan.
Sure. One of the questions that have come through that we hear often is, what about persons with less complex support needs getting the help they need? So we've talked about those with complex needs. And Alec, I don't know if maybe you want to speak to those with more complex needs. I know you've been a part of one of those projects over the past year.
Yes, certainly. And this touches also on one of the other goals as well. But some of the young people where they are really struggling, where services are really finding it hard to meet their needs. All too often, they've ended up in out of living, being transferred overseas to specialist services. One of the things that we've been trying to do recently is to look at ways in which we can create more skilled resource locally to bring young people back from overseas. We know that every dollar that we spend overseas trains staff overseas. If those same dollars are spent locally, then people are being trained locally, and we're building up a resource of skilled staff that can support people better. So that's one of the ways in which we're trying to support more people with more complex needs, and we have developed a group home which is got a slightly more intensive support and input, so that we can support people with slightly greater level of need.
And I might add, for those who have less complex needs, the goal is how independent can they be? And I'm an occupational therapist by profession, so independence is at the core of what we do. So if this person with less complex needs has the ability to live independently, has the ability to actually have a job or some level of job, to develop a skill, the goal is to enable the processes, the programs that are in the community or part of a variety of different of stakeholders. So I know we've talked to Tomorrow's Voices, we have spoken to WinReach. How can we have that coordinated approach to know that if this is the goal for someone to be able to live independently, this is where you need to ask for support, or if the goal is for someone to have, or they have an interest in vocational readiness and having a job, how can we ensure that from a very early age, they know that it is possible and that we are enabling that along the way. So it's across the spectrum. And so many times we could be very focused in one area, and then otherwise there are gaps that are left. So thank you, Alec, for that, because I think it's good to talk about both the complex as well as those who may be able to do something else. Sorry, I'm just seeing a question pop up here. So one of the questions is, will those receiving housing options also receive support in maintaining that household? Is that the group home you are speaking of? So the group home that we're Alec was speaking of is a complex needs group home that is supported through Mid-Atlantic Wellness Institute. And one of the discussions we're having, or I guess one of the gaps we can really speak to, is that currently intellectual disability services at Mid-Atlantic Wellness Institute has supervised group homes. And so if your loved one would benefit from a supervised group home, and we say benefit because we truly believe that it's best for anyone with intellectual disabilities to stay with their families as long as possible. But if a group home is going to be beneficial, there could be that person who does not need supervision and does need what you're referencing, which is maybe some financial support or support from other services that would help them maintain their home and to further develop skills. And so that is currently a gap that is in our community. And so that is one of those gaps that we would like to fill. So how do we look at a structure that has both supervised group homes and unsupervised group homes for those with intellectual disabilities that are striving to be more independent but have the supports that they need in place from a service, possibly like the community intellectual disability team that has been established. So I certainly hope that answers your question. So I know we've had a few questions that have come, but I'm hoping that if we have not seen any additional items that should be added to this goal list, that hopefully it means that we're on the right track. So please, again, you recognize that through the consultation website, you can still provide additional feedback. You can continue to put items in the chat if you have questions or have things you would like to add. And that consultation will go up until the 31st. So please continue to send it in. At this time, I'm going to move on to the Goal 2 slide, where we're talking about education and workforce. At this time, when you're looking at education and workforce, and Jose went through some of the training options, and Alec even spoke to it when it comes to the complex needs. Currently, most of our staff that work with those with intellectual disabilities have a nursing aid certification. Now, that's generally the minimum qualification. We recognize that with that level of training, you're learning to care for people. You're not always taught about how you can support and enable their independence. And so much of our discussion was talking about how can we ensure that the education and training level is consistent island-wide. And you would anticipate that if someone is being hired to work with a person with intellectual disabilities, that they have a basic level of training and understanding to be able to meet those needs at the time. So we're talking about the training course for support workers, and I can say, we've actively been working with Bermuda College, along with our community stakeholders, with Ministry of Education, as well as Ministry of Health, to look at ensuring that there is an additional level beyond the nurses aid training course that is available to those in the community, and how we can try to shift the expectation to suggest that it should be there. However, we also recognize that families need to get a level of support and training as well. What can you expect? What information is out there? How can you prepare yourself for those transition periods? And who can you reach out to? So certainly those were some of the top things that were being addressed. And we tried to look at training and education of the workforce as a well-rounded thing, not just for staff or just for those with intellectual disabilities. So I see a question that has popped up here, and it says, I hope we can work towards encouraging businesses to offer employment opportunities at some point too. The US has some great employment training programs that partner up with companies to provide employment for those with ID. So absolutely, I think it is high time, and I know the minister has been working on a few initiatives to encourage businesses to employ those with intellectual disabilities. And similarly, if we are training, and that last slide, probably slide 5 with the goal of self-advocacy, talks about how do we not only have those in the community that are families and professional supports, but also those with intellectual disability. How do we ensure that they're advocating for the supports that they need in the community? I also see an additional comment. It says, within this goal, I believe education and workforce also needs to be extended to people with ID too. And so we certainly will add that comment. And I do believe you will see it show up a bit more explicitly as we move forward. So thank you, Erica, sorry, for that comment. If I move on, and I just want to make sure that we have covered everyone. We're looking at policy, regulation, and accountability. So what do the government services do to protect people with intellectual disabilities? Now, you would have heard in the throne speech in November about the National Disability Case Register, and that's certainly something that the Ministry of Social Development and Seniors have been working on. The question is always, what does that look like? And how can we ensure that when it is in place, it's sustainable, as well as it gives us the information and data for that planning. Currently, we do not have a register. And so if anyone has read the national plan, we can guess that possibly based on the average of 1%, what our population of those with intellectual disabilities is, but we do not know for sure. And that makes it difficult to suggest how many people can we anticipate are transitioning and turning 18. We need to provide a level of support. How many people need housing options? Or even when we're looking at aging, are there those who are aging? How do they age in place? And do we have the appropriate location and housing for them? Because we know that older populations typically require a level access. So that is a big piece of what will drive our future planning that we would like to see put in place quickly. The one question and thing that I don't know too many people are aware of, we asked that question about, what will we do to strengthen the laws that protect our vulnerable people? And I don't know if many people realize that we don't have laws that protect our vulnerable people. We do have laws that protect children and those that protect seniors. And so we struggle to protect those who are between the ages of 18 and 64, who are just considered to be vulnerable. And so certainly we want to see how we can strengthen those laws to explicitly talk about anyone who is vulnerable, what that looks like. I do see something where it talks about eligibility will be based on individuals with ID as opposed to family for stakeholder oversight groups. So certainly we are looking to ensure that we have those that are that have an intellectual disability that are involved. And we want to talk about, who might be a part of that stakeholder oversight group. We're looking at family members, we're looking at advocates, we're looking at those with intellectual disabilities, and there many times will be stakeholders that are those who either have services in the community or are looking to provide services to fill a gap as well. So I haven't seen any other questions come in specifically around policy. And I know policy is many times something that we would prefer not to do, but it drives so much of what we do and how we can do it. It gives those who are in the field the ability to advocate for best practice. So certainly, if there is something that you think we're missing, again, please feel free to pop that into the chat. I'll go on to slide 4. Financing, that's the big money question. And that's always the question of, well, we're talking about having a transition. We're trying to ensure that there is coordination. We had a call today because our number was posted for comment where a family member is saying, my loved one is 19 and they're saying they have no space. Many times that is driven by the limitation of the physical space where a program is held, or the staffing or resources that are required to run it safely. So we're looking at, what is the budgets for the day programs? Is this the best way to offer them? And I think just to be clear, we've had much conversation with MWI, who has a day service, KMCC or K. Margaret Carter Center, who has a day service. WinReach has some day services along with Tomorrow's Voices. But how can we look at the different levels of supports that are required, and how can we coordinate our services so that even those in the community would have a sense of, this is someplace where I know I can go. This is the level of support my loved one requires. And even to enable family and family members to work as well, because many times the feedback that we receive is, well, if I need to stay home and take care of my family member, which I'm happy to do, it becomes very difficult to work. So certainly those are the reviews that we will be doing. The Community Intellectual Disability team is one of our newest teams, and they were specifically put there to fill the gap when there are loved ones that still live at home with intellectual disabilities. And we wanted to look at how they provide both allied health services as well as support for behavioral management changes if it's required in the home. So certainly, we're just looking at, okay, the team has been there for a year, and are they able to meet the needs? Do they need to expand their services? Would an expansion of services help to fill some of the additional gaps that we're hearing about? One of the questions that are here is, accessibility should be extended to not just housing, all goods and services needed to live a fulfilled life, example, transportation, ATM, financial services, etc. And absolutely, I think we certainly agree with that. And what I will share is, our intent was that this consultation process will be very much inclusive. So we wanted, and we recognized that with just being able to type into the chat, that may limit some ability for people to contribute. And so as we look at platforms that we're utilizing, the question is, how can we ensure that they are as accessible as possible? And certainly transportation and ATMs being able to access the community and community services is going to be very important. So thank you, Erica Smith, for that. All right, so if I have not received any additional comments on financing, I'm sorry, I'm just seeing that pop up. It says we also need to encourage and educate health insurers to appreciate and cover educational and therapeutic programs and services more comprehensively. So again, I think outside of the services that are provided through government services, including Mid-Atlantic Wellness Institute, they come at a fee. And currently, many struggle to have those services, and not only services, but even equipment, which has come up covered. And you talk about equipment, there are things such as communication devices that enable someone with intellectual disability to express what their preferences are. And we're talking about, those having choice. But if they don't have that equipment, if there's no support and funding for that equipment, they're actually left without a choice, and they're being taken care of. So certainly, Tina Nash, thank you for that feedback. It's certainly something we will ensure is incorporated throughout the years so that we can move towards ensuring that those coverages are discussed and that there's a plan in place. All right, I'm going to go on to slide 5. I'm sorry, I just see one other. It says Donna Ingham, financing here is where we reach out to IB for donations, so international business in a particular service, example, physio in group homes. So absolutely, Donna, I know that we do reach out to international businesses and a number of different organizations that are willing to assist. I think a great example is Friends of Hope. We worked on this, and you would have noticed in Dr. Bush's slides, there was some pictures and we utilized the program called Photo Symbols. The intent was to ensure that in the accessible version, which you will see online, and even when we're doing presentations, when we want those with intellectual disabilities to be involved, we recognize that pictures help to communicate the intent. So we now have photo symbols as an option for government, for KMCC, WinReach, MWI, everyone has access to that. And the intent is that we will continue to ensure that there's communication that is accessible and available so that those with intellectual disabilities can be involved and also can understand and communicate what their preferences are. So thank you for that, Donna. I have something from Natalie Barnett. What gaps are the community ID team covering at present? So thanks, Natalie, for that comment. So that community intellectual disability team falls under our services at Mid-Atlantic Wellness Institute. Currently, we've worked with Aging and Disability to look at a triage system. So if someone believes that they have their loved one that is 18 or over, and they have an intellectual disability, they can do a referral to their service. And many times they're talking about challenges that may include wanting to have vocational or some work experience, readiness, support, and training. They're also now have a physiotherapist and an occupational therapist as part of that team. So there could be that families who need to make some changes because they have loved ones with wheelchairs or require other equipment. The occupational therapist can go out to the home. They also are doing a clinic. They're setting up a clinic with K. Margaret Carter Center. So those clients that would be seen at home but are at day services can receive a physio or occupational therapy assessment and also receive behavioral support and training assistance through a psychology assistant as well. We have two aides at the time that will support those services. So we have rehab therapy, occupational therapy, and physiotherapy. We also have a case manager, which again, I think that has been challenging, and we heard that from families. So it would allow them to say what are the concerns. They can do a review, and then they actually try to meet the needs of the family based on what was expressed in the referral. So I do hope that answers your question, Natalie. And certainly if you have further questions, please feel free to put it in the chat or definitely give us a call. I do see another question. It says, under policy and accountability, are we looking at laws that will be refined to meet the needs of the intellectual disabled under the greater legislation of Bermudians with disabilities overall? And certainly we have not looked specifically to the legislation at this time. We know the vulnerable persons we are wanting to look at when it comes to legislation, but the intent is how can we try to provide some support globally and ensure that if there is legislation that already speaks to some of those needs, that it can be incorporated in that legislation. So I hope that answers the questions, because what we're not trying to do, as I somewhat mentioned, is create another segment with another law based on the this intellectual disabilities, because we recognize you have those who, again, could have autism that may not fit intellectual disabilities as it's defined. So we would also need to have another legislation for those with autism, and we certainly don't want to do that. So we're looking at overarching legislation, and certainly we will be working primarily with the Ministry of Social Development and Seniors, so that we can have a better sense of what that need will be and how we can make the greatest impact.
Could I perhaps just chip in there as well, Marissa? You're just thinking about one of those areas that possibly legislation would benefit from being introduced is around capacity and consent. one of the big gaps that we have at the moment is that we do not have any specific legislation to say, how do you assess whether somebody has the capacity to consent to a particular intervention? So we have many situations where our support staff take somebody along to a dental practice or to a doctor or a scene in the emergency room. They need an intervention, and the physicians are asking our support staff to give consent for that person to undergo that investigation. Well, that's not fair. It's not right. It's not appropriate for a support staff to be giving consent on behalf of somebody with an intellectual disability. But exactly the same issues apply if you have dementia, if you're deaf, if you're elderly, so that if we can develop some legislation that looks at how do we have a framework for assessing capacity and consent and making best interest decisions on behalf of somebody who perhaps lacks the decision-making capacity, then that will apply to everybody, not just to somebody with an intellectual disability. So that's just one example, I think, in response to the question about whether this is just about intellectual disability
And Alex, I think
legislation.
another area that impacts families greatly as well is Bermuda doesn't necessarily have guardianship laws in place. So I think it's an area to be explored. And because right now families are going through sort of a receivership kind of path to try and help manage various different aspects of a family's life. And it is always kind of a unique process based on which lawyer you get, which judge you get. So it's not really a efficient process right now. So I think that's one area as well that will be looked at as far as legal potential improvements.
No, absolutely. And I think, we have Sarah DeLacio who works with aging and disability. And so she's part of this team. So she also just popped into the chat, a reminder, and a great example is that when we have such as the seniors protection, now we're just looking to broaden that and looking at how do we protect all adults who are at risk of harm and have support needs. So again, that's our intent. And we'll certainly be looking for guidance. There's all sorts of support that's required when you're looking to change laws. So that will take some time, but certainly we're looking to be broad and to encompass as many adults as possible instead of being specific. All right, so I'm going to move on to the last goal of advocacy and communication. Now, this one talks about how people are involved in planning, and that should definitely be families, carers, those with intellectual disabilities. But the information that we're getting is families are not understanding. They don't know what's going on, and they don't know how to access the support. And again, I think I just want to validate that if we can get some comments coming in, is that how people generally feel in the public? Maybe, what they know, what they do not know, and what they're not aware of. And so some of the things that you see here is just about, the public in general being well informed. I think sometimes those who have family members or those with intellectual disabilities, they know what's happening, but the public don't feel as invested in what is happening because it doesn't have to do with them. And the public need to know. They need to be aware of what is being done for those with intellectual disabilities, making sure they understand the rights. I think a really good example, I've been working with the community intellectual disability team, and they're working with clients on inclusion. They want to be involved in community events. They don't want to be involved in something specifically for those with intellectual disabilities. But many times, because those who are responsible for those events, they feel as if, well, they can't do it like everyone else. I don't know if it's appropriate for them to be involved. And so it's having a lot of discussion around, well, they don't need to do it like everyone else. They actually just need the support, and they're very happy to be involved because being involved builds social circles, it builds understanding, it builds awareness. So, how do we inform the public? How do we make sure that the families and carers are involved in the planning of the delivery of services, and that people with intellectual disabilities are also involved? So again, those are just the overarching 3 objectives, and there certainly are some shorter term and longer term goals under that. But do we feel that we're moving in the right direction with these 3 objectives that are here? And if we believe that we're missing something, again, please feel free to chime in. Is there any, I just had a question, is there a forum for families and caregivers at this time? Jose, I don't know if you're able to speak to the forums that you are aware out there.
Yeah, what we're trying to do is make recommendations to government on coming up with a sort of a website or to improve kind of what is currently available to people. I think what's there now is of use, but I think it needs to be a little bit more tailored, a little more focused. And then so we're going to try and provide guidance toward that. I think, you know, over time, Bermuda has had organizations that have tried to bring together many of the disability concerns to advocate for them. But at the moment, I think it's, you know, there are a number of different charities that are kind of doing it kind of separately. So I wouldn't say there's any one that I could say right now is kind of, you know, makes coordinated effort really easy. But you do have great organizations like Windreach, Tomorrow's Voices, you know, Dame Marjorie Bean, a lot of places where you can go there. There's a lot of understanding and they can help support. But again, from an advocacy purely, you know, persons outside of those organizations, I would say I can't think of any at the moment. But again, that is one thing we're striving to improve and make better recommendations for the websites and things that are out there now.
And I'll just add, you know, we're talking about the websites because that's where people many times, if they're moving to the island, if they are just being identified, someone has an intellectual disability, they tend to go on and look for that information. What we want to ensure once they identify that information is that they know where to go. They have the contact information, they have the referral form if that's it, or they can give them a call and say, I understand, this is where I can receive assistance. And that's where the community intellectual disability team has tried to play that role, that when the person shows up, they will complete an assessment, they will do a level of intake, and then identify what supports they may need, whether it's from that team or whether it's actually from another agency or a service. So again, it's trying to ensure that those families and carers feel supported and that they don't feel like they are on their own. All right, so I appreciate everyone's feedback. I have not seen any additional questions or comments come in about this slide. So I am going to just ask Alex to follow with the next slide.
Thank you, Marissa. So on the third slide, we introduced this idea of this stakeholder oversight group, which wanted to explore a little bit further with people now. We see the stakeholder oversight group, which I must say, I find it as a very cumbersome title. It's a working title, and maybe one of the first things we need to do is have a bit of a competition to try and come up with a slightly jazzier name for it. But it is basically the group that will help to oversee how well the plan is being achieved. We see our rough idea is that it's got membership across the services, providers, different organizations, but also most importantly, advocates, i.e. people with intellectual disabilities themselves, self-advocates, people with intellectual disabilities themselves, and also advocates who are speaking for them, often family members. We see that group as meeting regularly and reviewing the yearly action plans. Marissa, would you like to just tell us a little bit more about how you think this might work? Because then we want to get some feedback from people about any ideas that they've got about how this group can work in partnership between families, individuals, and the services. So Marissa, just give us some ideas about your thoughts about this, please.
Sure, Alec. I suppose that, over the past year, as we mentioned, we have had a stakeholder group that was those who are providing services in the community. And we had a couple of carers and family members. At that time, we had, when we looked at those 5 core areas and the objectives, once we set them, we really looked to having a project plan and trying to get feedback on the progress that everyone was making. And so that's what's important. And I remember one of the comments earlier was saying, yeah, sounds good. These are the 5 areas, but we need some action. And this is where the action takes place. So it will be for this group to now be more diverse. Again, we do not suggest that just because we are a part of this organization that we know what those with intellectual disabilities need, nor do we know what the families and carers need. So this needs to become their plan. And this plan is purely the core of the launch pad, I think is a better way of where it can go. And so now that it's there and we're suggesting, look, we recognize this is what we're hearing and we want to see how it can progress, that it would be getting membership for those that are passionate about seeing a difference and ensuring that for their loved ones or for themselves, that there are changes within Bermuda that we're saying, we're calling you to be a part of this group. Let us know of your interest. And then this group will essentially take the reins where we left off at the end of this consultation with, I would imagine, a finalized plan to move forward and say, okay, what's next? Now that we have completed this part, what's next? And that they will continue to drive what they believe is needed in the future. As you said, it likely will still have some stakeholders that are part of our organizations involved, but certainly it is to try to get a sense from this group as to how do you think it should look, and how do we make those action plans moving forward. So Alec, I hope that sort of answered your question.
Yes, thank you. And I don't know whether anybody's got any other ideas about how they see that group functioning. I know one of the questions that has been raised is, how does someone volunteer to join the group? How, if I'm an interested parent, if I'm a self-advocate, how do I go about joining the group?
So at this time, it would just be to send, if planned, when you have the feedback on the feedback form, please let us know that you would love to be involved in the stakeholder oversight group. I recognize that there are sometimes, you're interested, but it depends on what it's going to look like. And again, as this group, it is looking at what does that team believe will be required to make a change. So initially, the stakeholder group that we have met weekly for half an hour, and that worked, and it really helped to drive things forward. Once we have the core plan, we started meeting monthly. Some people may decide that they cannot keep up with the group or as often as they will meet, but I certainly encourage you to put your name forward, even if you have an interest, and then we can, once the team comes together, you can then decide if it's something that you can do. I'm just seeing a comment here. It says, I think it absolutely essential to have self-advocates review all aspects, also for their feedback to be considered the most important for making a change. And certainly, thank you, Alyssa. We do believe that it is important and it's at the core. That is why we try to ensure that the information is accessible as possible. So I see here someone has also put a name idea for the group as PUMP. Persons undergoing meaningful progress for ID. So thank you for sharing that suggestion. I think it's going to help us get started in what that looks like. It's the only suggestion that's come forward, so I really appreciate you sharing that information. All right, Alec.
Okay, so let's move on to the final, well, almost the final slide. And this is really about, I asking you a little bit more about how you would like to be kept up to date with the details of the plan and progress. Just got, well, two real suggestions down there. Very, without a lot of thought that's gone into those. Would people like a quarterly newsletter? Would people like to attend an annual town hall type meeting? Are there any other suggestions as to how people would like to be involved? Marissa, I don't know if there are any other thoughts that you've had about how do we launch this? How do we make sure that people continue to be involved in what is happening with this plan?
So it's interesting, Alec. I was going to turn that around because that's it. We want to ensure that people continue to be involved in this plan. We don't want it to be a launch that we received the feedback, and then you're asking yourself down the road, whatever happened? We want it to be an opportunity to share what has happened. And the question that's coming is, is it just annually? Is it quarterly? And even if it's quarterly, you may not want a newsletter. You may find it helpful to have some sort of virtual forum or in-person forum. Again, virtually may seem very convenient to some, but may not be experienced by others as accessible. So, we are open to any suggestions that you have at this time, because certainly I think even with the plan, there are some details that it would be helpful for us to share about what we've been doing over the past year, because our goal as a committee was, we hope that we get support, but whatever we can do within our own sectors, we're going to move towards that objective and that goal. And so certainly we have been doing a bit of work outside of just putting the plan together within our areas, just to ensure that we're constantly moving towards an area of quality improvement. And we want to definitely ensure that it's meeting the needs and not just meeting maybe what's seen as our personal needs, goals, and objectives. So I have not seen, right? I have not seen any additional. I think I'm just getting one. Thank you for this work in terms of matching up the idea of updates on the plan and putting things in action. Have you considered piloting parts of the plan with family that need the help now? So Alec, I'm going to pass that one to you.
Match up the idea of putting things in action. Consider piloting parts of the plan. I guess is that asking about asking families about some of the particular aspects of the plan. I guess some of what we've been trying to do in the development of the plan has been every time that we're in contact with a family, with a client, we are picking up from them their views, their ideas, their concerns, and trying to incorporate what people are telling us. I met with somebody a couple of months ago who was really concerned about the issues of stigma, about how her daughter was at times quite stigmatized because of her intellectual disability. And that conversation that I had with her has helped to frame some of the priorities that we've been developing here.
Well, one of the things, Alec, that I thought might just be a good example, and I know we've talked about community intellectual disability team. I talked about that triage, is what we call it, process. So that was not part of the original plan.
Yep.
We were a bit concerned not knowing how many people would come into the service. Would they be able to manage it? But as they started out, and that would have been last year, April, we recognized that there was actually a bit of a need. So most people, when they are coming, do not know the service that they need. They cannot check that box. And so it was decided to actually do a pilot of a bit of a triage program that said, if for 3 months we will see everyone that comes through our doors, we will do a triage, we will identify, maybe the supports that they need in agreement to with the families and the carers, and then we will try to signpost, as you would see it referenced in our plan, where they can receive that service. We'll do that for 3 months, and then we will reflect on how beneficial that was for the team and for the service. So I think that's one way that, we can say, yes, there are pieces that we have piloted. There are others that I think we will pilot. And I see Natalie, I'm just going to jump to that because it asked about, but it helps to have a web page that provides the information and updates on the spot. We talked about the Helping Services website, and you would have seen that banner go across on the screen. But part of it is that we are receiving some feedback that it's not as helpful. People don't know how to navigate it as easily as they would like. And so we're looking at how can we update it, but possibly also pilot the changes to ensure that it is surely meeting the needs of those who are going to be using it. I just wanted to make sure I covered some of the other comments that came up about how we can be kept up to date. Was what about parish meetings? And I think that's certainly something, we talked about providing care close to home. And so the parish meetings can be a great idea and way of doing that. So thank you for that feedback. And I'm sorry, I just see as a follow-up question, it was using the work as case studies for updates and making progress in stages. So certainly, I think that was a great example because we can start down a road that's not necessarily going to meet the needs. Piloting something assists us in developing the information that will help us to refine the process so it does meet those needs. So thanks for that follow-up. So I think actually use the website, improve it by sharing information quarterly was the other comment that came through for this information. So, maybe I think one of the things that was consistent is the website. And we've talked about the Helping Service website, but if there is a way that we can provide updates from this team on the website, it will allow everyone to access it possibly in their own time, in addition to some of the other forums that we have highlighted on the slide. All right.
And I think one of the things to remember too about this plan is that it is just underway now. It is, yes, a lot of thought has gone into it, a lot of formulation, but it will be many different aspects coming together, and some things will happen sooner than others. So where there is a chance to pilot something, I think, yes, we'll take full advantage of that. There may be some things that'll be done, within the next few months, but other things will be over years. So we very much need the engagement of the community to make this as full and as well thought out as possible. So I think the more frequent the advocacy and engagement, the better. So we'll fully explore the website idea. And again, all these things are going through review now. So we're not able to put out a product just yet or a recommendation, but that's certainly ongoing.
Thank you. I wonder if we should move on to the final slide now with the just the reminders of the next stages in the consultation. Hand back to Alicia.
Thank you, Marissa, Alec, and Jose for your presentations. At this time, we now want to give the public a chance to ask some more questions and give some feedback. If you would like, you can enter your comments in the comment section on whichever viewing page you're on this evening, and we will give the presenters a few moments to answer that before we proceed. All right, so we have a question that came in. It says from Ms. Erica Smith, I think the consultation period might be too short and what the outreach activities scheduled. Will there be presentations with specific groups? Example, Bermuda College, Chamber of Commerce, International Business, City of Hamilton, Corporation of St. George's, the unions, key public sector service areas, etc.
Alec?
Oh.
So I'll go. It's okay. I know I've been saying so much tonight. I wanted to give someone else an opportunity. But certainly the intent is that this is a general public consultation opportunity. So it is available on the website. And the intent is that, yes, during that time to provide feedback. However, in addition to that, each of the stakeholder groups have reached out to those who are involved in their services, so they will be following up and getting feedback from them directly as well. We are in the process of reaching out to some of those other entities, possibly not all of them at this time. I think a big part is, are we moving in the right direction? And that's what the consultation period is about. There's another big piece about pulling the public on board to things such as, how do we ensure that those with intellectual disabilities are employed? How do we get people excited about supporting those? We have a big brother, big sister. How do we support those with intellectual disabilities and have them become a part of our community instead of possibly just living in our community? So certainly we'll be reaching out to many of those entities, but it will require, and I think once we get a bit of finalization on the core plan, we will also be reaching out to some of those other groups to share the work that we have been doing. And then this consultation process to say we have received feedback also from those who experience and live this on a daily basis.
Yes, I agree. I think the idea when we first embarked on this, it was in the middle of COVID. Our plans were to be having a series of town halls to develop the plans, and those are unfortunately, obviously, not possible. I think this needs to be quite a living process. This isn't a here's the strategy. It's now going to sit on the shelf for the next 5 years until somebody decides to dust it down and rewrite it in a slightly different format. The stakeholder group has been meeting for the last year. It's actually a tremendous amount of work that has been undertaken already. With, I think it's fair to say, more has been achieved in the last year or so than in my previous 6 years of working in this service. Far more collaboration, far more joint working, far more new investments as well. The community team, things have really started to move forward, and I think we've got the opportunity now to keep that momentum going. What we want is to have the basis of this plan, the principles of it, the main areas of it agreed as the direction of travel. It now needs to be continuously updated, so that it does become an evolving, living process with increasingly more and more family members, advocates and self-advocates involved.
Thank you for those answers. The next comment that we have came in from Ms. Joseph, who says, there are many caregivers and those with lived experiences of ID that do not engage in digital media. A good old town hall may be a bit more inclusive.
Yeah, and that
Yes.
would be ideal from the advocacy standpoint. It's a matter of trying to make that happen. But I agree. I love town halls because you really get a chance to share stories and understand what the challenges and frustrations were, and then see how that kind of meets these 4 different principles and 5 different goals. And then again, how do we address that particular concern? So yeah, I think that is in the future. It's a matter of how we can do it safely.
And I think increasingly there are some very effective ways of running town halls with the sort of World Cafe approaches, that we've actually got quite a lot of skilled people who can lead that process, and they can be incredibly productive. So yes, please, let's get back to town halls as soon as possible.
And another comment from Ms. Erica Smith. Thank you for this. It's needed. I really appreciate the direction, the core principles, and the priority areas. Progress takes time, and I appreciate that this is a work in progress. Where we can implement low hanging fruit, let's grab it and action it now, while concurrently progressing the medium and long term areas.
She feels like she's been sitting in on our meetings.
Yep.
So, absolutely.
Yes.
The past year, I think, has really been about the low-hanging fruit. What can be done? What can we do without any huge changes, any big financial changes? And I say thank you to Friends of Hope for the photo symbols. I think that's a huge step in the right direction, and an opportunity where it's not just one entity, it's all entities that are benefiting from that. That would be one of the low-hanging fruits that we have just seen it wasn't there at the start. It was part of the discussion, and certainly was a benefit of having the group together and then being able to finance it in a way that was within our own means. So we really appreciate the support. Thank you for the positive comments, but certainly, we're not here to just ensure that you've had us on the back, make sure that, we did a great job. We really want to know if we're missing anything, if we've forgotten anything. And it may be that, again, it was not considered for this year one plan or one of the objectives, but if it is anything we think we should be focusing on, we want you to share it. Again, you can go to the consultation website, you can send an email, and you can even call. So that phone number is there. If you do not get a person, please leave a message and just communicate what your feedback is. It will be documented and included in the consultation feedback.
I think another important aspect of this opportunity as well is the fact that if there's things within the plan that you really think are good and worthwhile, that that needs to be heard, that needs to be advocated, because some of these concepts, like the registry, we've been thinking about this for a decade. We've a few different times have gone around. Well, how do we actually implement this? And then things kind of sit for a few years. So again, if there's things within the plan you think, yes, absolutely, this should be done, then we need strength in numbers, and again, everyone's idea and engagement to really make this happen.
And I'm also going to add, I received an email earlier today where I believe there's another entity working on some level of a registry, and they've done a whole, I would say, a literature review on maybe what's the best way to do that. And if there are others that are out there in the community that have looked at, the financing piece, the policies or legislation, please, again, reach out. It may not be exactly specific to intellectual disabilities, but it could be an opportunity to collaborate and utilize the work that's already put in to have some overarching drive forward so that we can put these things in place that are needed for a number of populations, but that can be consistent. So do not think that if it's not intellectual disabilities, we're not interested in your feedback. Please feel free to share. And that was it for me.
Thank you, Marissa. So to the listening public, if there's anything else you would like to add, we would like to invite you to view the full version of the plan. The easy-to-read version and audio versions are available on the Bermuda government website at forum.gov.bm/en/projects/ID plan. You can also give feedback through the government website via the poll, or you can email idplan@bhb.bm. The telephone number is 249-3462. And as a reminder, the consultation is open from Tuesday, May 17th until Tuesday, May 31st, 2022. As we close out, I would like to see if any of the presenters have any final comments. We can start with you, Marissa.
You caught me off guard. When does that ever happen this year? I just want to say thank you. I think those are my final comments. For those who have joined us tonight, thank you so much for taking the time to come out, to provide your feedback, for letting others know about the work that's going on, and for your encouragement. This is certainly not one of those areas that tends to be discussed but we want to make a difference. And I am inspired by the passion of all those who were on the committee. So those of you that are watching tonight, thank you so much for your commitment as well. And have a great evening.
Alec?
No, again, just thank you. It's been a fantastic 12 months or so working on this. I can't tell you how enjoyable it has been working across all the different agencies and advocates. I think the big challenge we're going to have is how do we genuinely start listening to the voice of people with intellectual disabilities and having their voice as part of this process. I know it can be done. I've seen it done, but it will take quite a lot of work to make that happen.
Thank you. Jose?
Yeah, and I would just like to thank all of Bermuda, and particularly those communities that have persons with intellectual disabilities. Over the years, again, we've seen, just the depth of people's caring and love for these persons to make their lives as full as possible. And as a parent, honestly, there's nothing greater. So really appreciate that. And we're just trying to make things better. And we need everyone's encouragement, everyone's advocacy to make Bermuda, the intellectual disability community, be as vibrant as everyone else and have wonderful lives. So again, thank you.
All right. So on behalf of the Ministry of Social Development and Seniors, I want to thank you all for joining us tonight and wish you all a great evening.
Thank you.
Thank you.
Thank you.